Short-term health insurance buyers are increasingly asking AI platforms for recommendations, comparisons, pricing guidance, and plan shortlists. That changes the competitive moment. Instead of scanning a full search results page, the buyer may see a compressed list of carriers that an AI system believes are credible, relevant, and worth considering. For CEOs, CMOs, and growth leaders, the strategic issue is clear. If your brand is mentioned but not recommended, you may still be invisible at the moment that matters. Hey, I'm Mark Huntley, founder and CEO of CiteWorks Studio. At CiteWorks Studio, we study how brands show up across Google, AI answers, and the public sources buyers trust before making decisions, and how that visibility turns into credible citations, comparisons, and recommendations. This benchmark studied short-term health insurance in the United States across 10 measured carriers, including UnitedHealthcare, Golden Rule, Agile Health Insurance, Companion Life, eHealth, Everest, IHC Group, Independence American, LifeShield, National General, and Pivot Health. The analysis covered 799 observations generated on June 17, 2026, across ChatGPT, Copilot, Gemini, Google AI Mode, Google AI Overviews, and Perplexity. The public benchmark focused on 3 high-intent prompt clusters: best health insurance plan discovery, provider comparisons, and pricing and cost evaluation. It is a point-in-time benchmark, and the modeled values are estimates based on commercial intent proxies. They are not revenue, pipeline, or booked sales. The strongest finding is that recommendation power is concentrated in 2 carriers. Pivot Health and Everest each earned 54 valid recommendations across 799 observations, or about 6.8% valid recommendation coverage each. No other carrier in the dataset exceeded 1.75% recommendation coverage. Pivot Health led on rank quality. It had the best average recommended rank among carriers with significant recommendation counts at 1.91. It was named first in 14 observations, and on Google AI Mode it reached a 4.44% rank 1 rate with an average rank of 1.4. Everest matched Pivot Health in recommendation volume, and its net sentiment score of 0.56 was the highest in the category. The difference was position. Everest's average recommended rank was 2.57, meaning it was strongly framed but less likely to own the first slot. That distinction matters because AI-generated shortlists compress buyer evaluation. First position, top 3 placement, and recommendation coverage carry different commercial meaning. The benchmark's clearest warning signal is National General. National General appeared in 9.9% of all observations, the 3rd highest presence rate in the category. It also held the highest total AI authority value at $564,680 per month. But that value was driven largely by visibility assist value, not recommendation value. National General earned valid recommendations in only 1.75% of observations, had the lowest net sentiment score among carriers with meaningful presence at 0.23, and carried the only negative sentiment observations in the dataset. That is the core leadership lesson. Raw presence is a weak substitute for recommendation stage visibility. A carrier can be cited, named, or used as a comparison anchor without earning shortlist credit. For short-term health insurance brands, the board-level question is whether AI systems are merely recognizing the brand or actively advancing it into the buyer's decision set. The pricing and cost evaluation cluster is especially important because it reflects buyers closer to a coverage decision. In that cluster, Pivot Health achieved a 6.83% top 3 rate with an average rank of 1.65. That is the clearest recommendation leadership signal and the highest intent part of the benchmark. National General showed the opposite pattern. It appeared in 11.95% of pricing and cost evaluation observations, but earned recommendations in only 1.02% of them. That gap matters for growth teams. Awareness stage visibility can make a brand appear present in the market. Decision stage recommendation coverage shows whether the brand is being trusted when buyers ask AI systems what to choose, what to compare, and what may cost less. Several other carriers, including UnitedHealthcare, Golden Rule, IHC Group, LifeShield, and Independence American, appeared in AI responses but earned 0 or near 0 valid recommendation credit. That means they were present in the answer environment without consistently entering the shortlist. The report points to the public evidence layer as the strategic battleground. AI systems build responses from sources they can retrieve and synthesize: official carrier websites, plan comparison articles, editorial review coverage, state insurance department resources, consumer advocacy content, forums, review platforms, and search visible pages. Strong citation architecture gives AI systems clearer material to work with. Thin source footprints limit participation. Mixed or cautionary public signals can create visibility while suppressing recommendation eligibility.
That appears to be the pattern in the benchmark. Pivot, Health and Everest benefit from stronger recommendation framing. National General has broad presence, but enough mixed sentiment to weaken shortlist performance. Smaller or less cited carriers have limited retrievable evidence and minimal recommendation participation. For marketing leaders, this turns AI visibility into an evidence strategy. The task is to improve the quality, consistency, and retrieval strength of the sources AI systems use. The commercial takeaway is direct. In short-term health insurance, AI-led discovery is moving value toward carriers that earn ranked positive recommendations and high-intent prompts. Executives should monitor mention presence, valid recommendations, top 3 rate, rank 1 rate, sentiment, prompt clusters, and citation sources separately. Blending those signals hides the most important gaps. The benchmark shows a market where 2 carriers capture most recommendation power. 1 highly visible carrier carries significant recommendation risk, and several known names have limited shortlist eligibility. If your growth strategy still treats AI visibility as a mention count, you may be optimizing for the wrong outcome. The goal is recommendation stage visibility supported by a stronger public evidence layer.